Good evening and welcome to Health Check tonight. My name is Grace Mutiso. Now, yesterday, the 20th of March this year, we were celebrating the World Oral Health Day. And of course, tonight, our focus is on children's dental health. Do you have any question regarding that topic? You need to start engaging us on that. Our SMS line is 22232. That is 22232. You can also engage with us via our WhatsApp line. That is 0708 222 323. That is 0708 222 323. Remember, we're also live on Facebook and YouTube. Our handle is at Hope TV Kenya. Good evening. My name is Grace Mutiso, and tonight to help us discuss about children's dental health is Dr. Johnson Wambugu. He is a dentist, and we are glad to have him in studio with us. Good evening, Dr. Wambugu.
Good evening, Grace.
How have you been?
I've been fine.
Yes.
I am so happy for you guys inviting me.
Yes.
It's a pleasure.
Yes.
And I mean, you've grown. I've been coming to Hope FM, and I'm so happy to see that now you have a good TV station.
Yes.
Yes.
I think it's a good platform where people can put the face to the voice.
To the voice, yes.
Okay.
Yes.
Welcome so much. So for those who don't know you, you could take a minute to introduce yourself to us before we get to the topic.
Yes. So my name is Dr. Wambugu. My patients call me Daktari, but Dr. Johnson Wambugu. I have been a dentist for 17 years. I have worked in private sector, public sector shortly, and faith-based sector. Currently, I'm running my own private practice. And and that's what I do. And I am married with 2 children, and I am a born-again believer.
Amen.
Yes.
Amen. Karibu sana. So yesterday was World Oral Health Day.
Yes.
So what are some of the key focus you celebrated?
So World Oral Health Day is held every year on the 20th of March. And it's held all over the world. So around the country, we had a number of activities that were being organized by Kenya Dental Association. I know many practitioners, many dentists who are volunteering their clinic and time, and patients would come over to their offices, and there were also outreaches to children's homes and things like that. So that was what was happening yesterday. Yes.
So for future, we wait until next year. So immediately 20th gets, so as a citizen or as a viewer,
Yes.
what are some of the things we can take note of to take advantage of this day?
So usually it's public association. However, October, breast cancer month. November is oral health month. So that time, there are usually even more activities that happen over a prolonged period of time, because it happens over the whole of November.
Yes.
Yes. So, that's something to look forward to. But you don't have to wait until November to have your teeth checked.
Yes.
Yes.
Okay. Thank you. So let's get to our topic of today. We are focusing on children's dental health.
Yes.
A very crucial topic, and maybe a parent would wonder, why should they why should they worry about my child's teeth, health? I think when they get to an age where they're supposed to go to school is when I should focus on that. Do you want to mention something about that?
Yes, because first of all, teeth are important. Teeth are important for speech. Teeth are important for nutrition. They're important for your appearance as a child. And the milk teeth that we get, the children get, we get 20 of them, and I'll talk about that later. They actually hold space for the permanent teeth that start growing from the age of 5.5. So if you lose the teeth too early, number one, obviously, the child will have issues when the permanent teeth are now growing. There will be not enough space for those teeth to grow. That's number one. Number two, you don't want them to have issues with speech. Tooth decay causes pain, so you have children losing school days because of pain. They can't concentrate. Issues to do with self-esteem. So there are a lot of reasons why you should take care of your teeth, especially the milk teeth.
Yes.
Yes.
Okay. Thank you. And we'll be getting deeper into that. So maybe you could take us on the different stages regarding the growth of a child's teeth from inception.
Yes. So I think I would step back and talk about pregnancy, because that's where it all starts.
Yes.
So there is this myth or misconception that when you get pregnant, you should not have any dental treatment. But one thing you need to know is that when you're pregnant, your hormones go haywire. I mean, they're elevated, and so you have, and also your immunity is reduced because you're carrying a being inside you. At that time, most people will have what we call morning sickness. Others will have cravings, and the impact of that on your teeth, as the mother,
yes,
is that pregnant women are actually more susceptible to getting gum disease because of hormones. And studies have been showing that even gum disease has been shown to actually have an impact on the baby, in that you can actually get a preterm baby because of having gum disease. Now, cravings, most people will start having sugary cravings.
Oh, yes.
Yes, and those cravings now are what now will actually cause you to get tooth decay. And we've talked about even vomiting and morning sickness, having an acidic environment in the mouth. So you actually predisposes you to getting more and more cavities. So when you get pregnant, as you see your gynecologist, as you see when you're looking for a pediatrician, it's important to also see a dentist. So that if you have any dental problems, they are addressed in your first trimester.
Yeah.
And it's important to tell the dentist that you're pregnant so that we take precautions, because maybe we may need to take x-rays and things like that.
Yes.
Now, you need to make sure that your oral hygiene is really good, because, as I've said, you're more predisposed to having gum disease. And because of your cravings, you will probably be snacking at night on sugary things, what we call fermentable carbohydrates, and that will actually predispose you even further to cavities. Now, should you have any problem when you're pregnant, there has been a myth that you should not see the dentist. It's contraindicated. But what I want to say is that you cannot wait for 9 months to solve a problem. That you'll only see the dentist after you give birth. So you need to actually see your dentist as you work with your gynecologist also. I have seen ladies come to see me and tell me that, I lost my teeth because of my children. And so if I count the number of children they have, I should be able to count the number of teeth that they've lost.
Yeah.
And then they'll attribute that to calcium. Yes, it is true when you're pregnant, the fetus or the growing baby usually triggers a response where you have the body actually absorbing calcium from the mother.
Yes.
But that calcium is absorbed from bones, not from teeth. So tooth loss in pregnant women is actually as a result of cavities. Okay? And cavities are when you have prolonged contact of acidic acids, okay? And all of us have bacteria in our mouths, and I'll talk about that later. And that bacteria loves feeding on fermentable carbohydrates. And then the byproduct of the two is an acid, which attacks the teeth slowly and slowly. We've also talked about morning sickness, where women will sort of gag, will sort of throw up, and probably at night, and they will forget to brush their teeth.
Yes.
And that vomitus has acid in it. So you end up getting more and more erosion of the teeth, and you end up now having cavities forming and gum disease. So even as you're taking care of yourself, because I know ladies are when they get pregnant now with the internet, people Google how to take care of themselves. We need to also take care of our teeth.
Yes.
So regular brushing and flossing, okay? And if some women complain of gagging because of, as they brush, the palate becomes quite sensitive, you could probably be more gentle as you brush, maybe change your toothpaste if that's what's making you feeling like you want to throw up. Yes, and just make sure that if you have any problems, any dental problems that you had even before, that they're sorted out.
Yes.
In the third trimester, usually it's a tricky time to treat mothers, because when they sit on the dental chair, you're not able to lower their backs because of the baby. So we like doing a lot of treatment in the first and second trimesters. Not to say that it cannot be done in the third trimester, but it can.
Okay.
Yes.
Okay. So that's about the mother.
That is about the mother.
As a mother, an
Yes.
expectant mother, you've taken care of yourself well.
Yes.
And I know those who are watching and the cravings, and we usually say it's the baby who wants.
Yes.
So you've taken care of yourself well, and now the baby is here. And before the baby being here, are there things that a mother needs to do to help the baby's dental health while
Yes, now that you mention it, so obviously the diet, your diet, if you are, I'm sure the gynecologists will advise you on what diet to take. But just to say, I mean, if you're taking something, you need to take foods that are healthy and are rich in calcium, so that you don't lose calcium. But I have said that the calcium is actually absorbed from the bones, not from the teeth. Okay? The tooth loss if you forget everything I've said, tooth loss in pregnant women is because of cavities and gum disease. And the cavities is because of the cravings, the lack of hygiene, and the gum disease. So the nutrition, now to come back to your question, the nutrition is important for the sake of the child.
Yes.
Because whatever you feed on is the same thing that will be transmitted to your child. Yes. So now the baby teeth are formed in the uterus. Okay, that's something we need to. They're not formed when the baby is born. Some are, but majority are formed in the uterus. So when the baby is born, what happens is that if you were to take an X-ray of a newborn baby, you'd actually see the developing tooth buds underneath the gum. Now, so you've gotten your baby, and now you've. I have been called sometimes by pediatricians when a baby is born and they're born with teeth.
Yes, what is that?
And we call that natal teeth, when the child is born with the teeth.
Yes.
And what we usually do is that we assess whether the teeth are shaking, okay? And if they are shaking, because they can actually become very loose, that is when we think of removing them. If they are firm, on the other hand, sometimes we leave them. If the teeth grow within a month, we call those ones neonatal teeth.
Yes.
And the same thing, usually we check whether they're shaking, because some of these teeth are actually false teeth in that they don't actually have a root. And they can be a hazard to the child, because as the child feeds, they can actually become loose.
Yes.
And the child can actually accidentally inhale them. We call it aspiration. So when the pediatrician calls us, that's what we do, we assess. The other thing those teeth can do is that they can actually traumatize the mother as the mother is breastfeeding. And if it becomes so painful to the mother and that the mother is not able to breastfeed, yes, we can actually maybe round off the teeth so that they become a bit blunt if they are firm.
Yes.
But the most important thing is to check whether they are firm, to avoid injury to the aspiration by the child, what we call inhalation by the child, or trauma to the mother.
Okay.
Now, once we identify that the teeth are firm, we also want to check whether they can traumatize the child in terms of feeding. Because if the teeth are sharp, they can actually traumatize the tongue. We call that Riga-Fede syndrome, where you find the child having a wound on the tongue because of the sharp teeth.
Yes.
So that's one of the things that we check for. Now, traditionally, I have seen this. Children usually, some people would take children to a traditional healer to remove those teeth. And I would really encourage people to seek professional help, because some of the tools they use are of questionable hygiene.
Yes.
And you can actually now have the child now getting infections, tetanus infections on the mouth, which can be life-threatening. So if you find that the child has this, I would rather you see a dentist. Yeah. And so now the child, that's now from 0 to 6 months.
Yes.
Now, at 6 months is when we expect our first teeth.
Which one?
Yes, that's what I'm going to show you.
Yes.
So we expect our first teeth at 6 months. Now, this is not fixed. It can be earlier. There's some children, we call them early toothers. They get the teeth early.
Yes.
So every time I say a time, please add plus or minus 3 months.
Okay.
Because I have seen children as late, getting their teeth as late as 12, 13 months, their first teeth. So women will call me when they have panicked. My child is turning a year, it's her first birthday, and they don't have teeth. So I have seen 13, 14 months, and that's when now, maybe at 14 months to 1.5 years is when now you should get worried.
Yes.
But the sequence is like this. So the first two teeth that grow start on the bottom side. Okay, on the bottom teeth, these two start first.
Yes.
Okay, so the first teeth that will emerge from the gum are the two front lower incisors.
Maybe you could lift it so that we...
Yes, these ones right here. Those are the first ones that you'll see at 6 months.
Yes.
And I've said this is not an exact date. No. It can be plus 3 or minus 3.
So it varies per child.
Varies per child. Now, the fake teeth I was talking about, the neonatal teeth, the teeth that the child is either born with or grow immediately after 1 month, are usually actually the same. Those are the most common that you see, these two.
Yes.
Okay? Now, the next teeth that you'll see at around 8 months are these two. So if you look at an 8-month-old baby, 8 to 9 months old baby, they usually have 4 teeth.
Yes.
These two
and
these two.
Yes.
Okay?
Yes.
Then after that, the next two are these two, the next two bottom ones. Okay, will come.
Yes.
Usually at around 9 months, 9, 10 months, you'll find those teeth.
Yes.
Then after that, the next two are these ones. In some children, you'll actually find these two first, then these two, and then the next two, and then these two. Okay?
Okay. Yeah.
Okay? Okay. Then after that, so now by the time the child is ideally, let's say 14 months, they have these 4 teeth here in front, and then they have the same 4 teeth in front. Now, the process of the teeth emerging from the gum is called teething.
Yeah.
And we'll talk about teething,
Yeah.
because that's a very big concern. So you have, by 14 months now, you have these 4 teeth here and these 4. Now, next thing that happens is that now you get the first molar here. One thing you need to note is that, one thing you need to note is that these children don't have premolars. Premolars are found in adults.
Okay.
Okay?
Okay.
Adult teeth. So the premolars will start growing at age 9. Around 9, 10 years of age is when the premolars will start growing. So now, after we get the first 4 and these 4, we'll jump the canine and come to this first one. So this one will grow, the first molar, and then after that, this upper one will grow.
Yes.
Okay?
Yes.
Then after now, those ones are that's the point at which the canine will grow at about 18 months. So about 1.5 years is when now you'll see the canine emerging.
Yes.
Okay?
Yes.
Then the last ones to grow now, to emerge from the gum, what we call eruption, will be the last molar here, and then the upper last molar. So we're talking about by the time the child is 24 months all the way to 33 months, you're talking about 2.5 years.
Yes.
They should be having all these teeth. And
Is
they're
that also plus 3, minus 3?
Plus 3. So 33 is usually what we say. 33, let's say 2.5 years.
Yes.
By that time, at least all the teeth should have the child should have all the teeth in that year. Now, you asked a very important question. Now, these teeth, don't forget, will all be replaced at some point.
Yes.
So these teeth are 20, but an adult has 32. So another 20 will grow, and they will actually replace these ones. Then you'll get an extra 12. Okay? Yes. So if you lose these ones early, what will happen is that the spaces will start disappearing. Okay?
Yeah.
And when the time comes for the teeth to grow at now the proper age, what will happen is that now the permanent teeth will erupt and find no space.
Yes.
Now, before we continue, let's talk about teething. Because teething is a headache to most parents.
Actually, I wanted to ask
Yes.
Dr. Wambugu.
Yes.
So when all these teeth are growing,
Yes.
is there a tip you could share with parents what they need to bear in mind in all those stages? So for here, maybe a child would be cool, calm, collected. So what happens when it comes to these ones?
Yes, because those ones are bigger. Okay, let's just say that teething in general, the symptoms are the same, regardless of what teeth they are. Probably some because they are smaller and they'll penetrate to the gum at the surface area is small. So at that, probably those ones will cause less symptoms.
Yeah.
But generally the symptoms are the same. So you'll find a child becomes fussy all of a sudden. They want to put toys in the mouth. They're drooling, okay? Children will want to pull their ear like this, especially the molars. You find a child doing like this, which is associated with ear infections.
Okay.
Okay.
Yeah.
You'll find the child wants to stay on the breast longer because any sucking and any motion they will gives them that soothing. It will soothe their gums.
Yes.
The other thing is that they are crying all the night. So those are the symptoms of teething.
Okay.
So what do you do? Now, the other thing is that, sorry to go back, is that children will want to put fingers in their mouth, their toys, dirty toys in their mouth. And so what has happened traditionally is that people have associated teething with the child all of a sudden starts diarrheaing.
Yes.
And so traditionally in our African societies, what they would do is that when the child starts now diarrheaing, they would associate that with teeth. And because of that, you'd actually have in some communities, they would actually remove teeth buds. What we talk about female genital mutilation, we also have what we call infant oral mutilation, where they would use crude weapons to actually remove those teeth buds because of the association of the teeth with the diarrhea.
Which is not true.
Which is not true.
Yeah.
The reason why the child is getting the diarrhea is because of putting dirty objects in the mouth.
Wow.
So when you notice your child is teething, the first thing you need to do is always make sure that their toys, anything that they're playing with, is clean.
Yes.
Number two, because they'll want to put all these things in their mouth, make sure any toys that they have, they can't choke on them. Okay?
Yes.
In the West, I have not seen them here. Maybe they're there, but I haven't seen them. They have what they call teething toys made of food-grade silicone, which they are chewy, and the child puts them in the mouth so that they can soothe the gums.
Yeah.
So that's one thing that you can do. You can actually give them that. The other thing is to, the teething gels that are available in the market, but I would use them with caution because what these teething gels do is that when you apply on the gum pad, they have a numbing effect. And now that can actually numb, for example, if the teeth are growing on the upper side, what can happen is that can numb the palate, okay? And that can create problems that they can be a choking hazard because the child cannot now feel the palate.
Yeah.
So use them with caution and only apply the places the specific place that is happening.
Okay.
If the child is over 6 months, it is safe for them to take paracetamol.
Okay.
So you can do that. When my children were teething, we would peel a carrot. A big carrot, not a baby carrot, because they can choke on it. Big carrot.
Yes.
And you give them, and they will see the child wanting to bite on it, and just to soothe, and it helps.
Yes.
Yes.
Okay. Allow us to pause there. When we come back,
Yes.
I would want us to focus more on, so what happens? A child has grown and the milk teeth, they have lost a milk teeth because of the jumping and all that. So what happens and what precautions can parents put in place to avoid that? You're on Health Check right here at Top TV, Look and Live. My name is Grace Mutisa. I'm hosting Dr. Johnson Wambugu. Our focus for today is on your child's dental health. Do you have any question? 22232 is our SMS line and our WhatsApp line is 0708 222 323. They are right at the bottom of your screen. Remember also to engage with us live at Top TV Kenya on Facebook and YouTube. We'll be sampling some of your comments when we come back. Keep it right here.
This week on Testify.
This guy came and he opened the Bible. They told me, he read for me, do not drink water only. When I attempted to drink, most of the half of it fell on my chest.
You're still shaking.
I'm still shaking. So the guy here, he told me, now I have known why you are shaking. The place where we read,
Yes.
it said wine. This is alcohol. We have to change.
Hope TV. Look and live. Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi. Hope TV is where you look and live, with an excellent selection of the best Christian programming consisting of local and international content, of inspirational stories, talk shows, Bible commentary, youth, health shows, children entertainment, contemporary gospel music, extended times of worship, live broadcast, news, movies, drama, Christian ministry programs, and so much more. Hope TV is another quality service from Christ is the Answer Ministries, with over 45% of authentic and credible local content every week. Hope TV is a sister station to Hope FM, Kenya's leading Christian radio station, with footprints across the country. Tune in to Hope TV, where you look and live.
Welcome back to Health Check right here at Hope TV Look and Live. We are talking about your children's dental health. I'm hosting Dr. Wambugu, our guest for tonight. And of course, this is the hour we'll be looking at your questions at Hope TV Kenya. Our SMS line and WhatsApp line are at the bottom of your screen. Please feel free to ask any question and we'll be glad to answer you. Dr. Wambugu, before we went on a break, we promised when you come back, we'll focus on, so the milk teeth grew and my jumpy son decided to jump. And one of it
Came out.
shaking or came out.
Yes.
So what do you do?
So, now, the thing with milk teeth is that one day they'll be replaced.
Yes.
So what we usually do is that we assess the severity of the trauma. So for example, it's a front tooth. You need to see your dentist urgently. And because we have many types of injuries, the tooth can break. You can have the root inside break, or probably the tooth, because of the trauma, the tooth now, using layman's terms, dies. Yeah. Okay, and some treatment needs to be done to ensure that that tooth will stays there for as long as possible. The teeth that will be lost most of the time will be the front teeth. Yes. So there are ways we try to maintain that space. We call that space maintenance, where we put an appliance or something to maintain the space, so that by the time the teeth are growing at the correct age, the teeth will find space. But if they are lost, we usually follow up the child, so that if the tooth is not treatable and the tooth has to be lost, at that point is when now we will advise the parent on what is supposed to be done. What I would advise is that if you have trauma, just have the child see the dentist as soon as possible.
Okay.
We take x-rays, we rule out all these things, because the degree of injury is what determines the mode of treatment that will be employed. Yes.
So before we go to how to
Yes.
brush our children's teeth,
Yes.
especially from the first day you see the first tooth, what you need to do,
Yes.
let's talk about fluoride.
Yes.
Is it safe for our children? If yes, at what age should we introduce it?
So fluoride is an important mineral, okay? And it is naturally found in water.
Yes.
Now, when it is too much, that's where the problem is. Now, fluoride, when it's applied topically, like the way you apply Vaseline on your skin, if you apply fluoride topically on teeth, it actually hardens the teeth, okay? In fact, in the West, because some of the water supplies there don't have a lot of fluoride, they actually fluoridate the water. But the water we have in our Kenyan context here has some fluoride. That's why we don't fluoridate the water. But so fluoride, when applied topically on the teeth, actually hardens the teeth.
Is it a good thing or a bad thing?
That's a good thing because
so in short, they can take that toothpaste and just rub it.
So, what I want, I would say is that, you see, the thing is, the fluoride, when it's in excess, that is where the problem is. Now, fluoride, when most of the fluoride in our context here, as I've said, comes from water.
Yes.
And when the children get their first teeth, because the question is, when should you start brushing your teeth, the children's teeth? Yes. When the children get their first teeth is when you should start brushing them. So at 6 months is when you start brushing the teeth. Okay. Now, we advocate for using age-appropriate toothpaste. So the toothpaste that has for every age, so for example, from age 0 to 1, or from age 2, has a level of fluoride that is not the same that is found on adult toothpaste.
Yes.
So because children tend to swallow things as you clean their teeth, we advocate for using either non-fluoridated toothpaste or just use very little but age-appropriate toothpaste which has little fluoride, because that fluoride will actually harden the teeth. So don't use adult toothpaste, use age-appropriate toothpaste.
Okay. Noted. Yes.
Now, it's a good thing you're asking about fluorosis, because fluoride, as we speak right now in Kenya, or in our setup here in Nairobi, is actually a public health concern. Now, before we had all this urbanization and all these real estate grew, most of our water in Nairobi used to come from Murang'a and the highlands in Kiambu and all that. But what happened is that as Nairobi grew, the water supply did not grow with the amount of demand that we have. So what happened is that all these people, all the real estate projects that happened in Nairobi, people would now build buildings and are forced to drill boreholes to meet the demand. So most of the time, that water that is pumped from your borehole, and the children and we consume that water, most of the time it actually has very high levels of fluoride. Now, the fluoride mostly affects the permanent teeth, okay? However, it can affect the milk teeth that are formed after birth, okay? So you remember we said that the milk teeth are formed in the uterus, eh? That's when they start forming. Yes. But the back molars and the molars and even the canines, the formation starts being completed many months after birth. So those ones can actually be affected by taking much water with a lot of fluoride. So what happens is that the fluoride in the water replaces calcium. Okay, so when the tooth is being laid down, when the enamel is being laid down, the outer part of the tooth called enamel, when it's being laid down, the fluoride interferes with that laying down, and fluoride is actually incorporated. So what happens? You end up with brittle teeth with weakened enamel, and when the tooth grows, it picks up stains and now turns black. Okay. Yes. So or brownish and things like that. So what I would advise people, because fluorosis is a big problem in this country, in Nairobi, is number one, if you do not know your water source, or if your water source is a borehole, you need to test the water. There are many places you can go to have the water tested. You can go to the Kenya Bureau of Standards, you can go to the Kenya Water Institute. I know of colleagues who do that, who test the water to know how much is your child consuming in terms of water with fluoride. Now, the fluoride will not affect you as an adult because you already have your teeth. They don't affect your teeth. Because some people will say, I have bad teeth because I consume water which has a lot of fluoride. It actually affects the developing teeth, especially the permanent teeth, all the way to age 9. That because most of the teeth are formed during that time. So you need to, number one, you need to test the water in your house. And I have seen even patients living in suburbs in Nairobi who have fluorosis. We're talking about Kilimani, Kileleshwa, Westlands, Traditionally, fluorosis used to be associated with the Rift Valley, Naivasha, Nakuru, parts of Murang'a, but now it's actually right here in Nairobi because of the boreholes. So it's important to know. And if the fluoride levels are high, you can invest in a defluoridating machine that actually you fix on your sink, and the water that comes from the water that you consume in your kitchen has been defluoridated. The amount of fluoride has been reduced significantly.
Okay.
And we also consume vegetables that are coming from areas that have a lot of fluoride. So we need to make sure that the daily consumption of fluoride that our children are getting, because you have no control over your food. If you go to the supermarket, you don't know where the food was grown in Naivasha or Nakuru. You really don't know. But if you can reduce how much fluoride the child is taking, that would really go a long way in reducing the amount of fluorosis.
Okay.
Yes.
Let's now go to how do we brush our children's teeth.
Yes.
Let's start with the 6 months one. You know, the teeth are too small and they're just 2 or 4. So how do we do that? Then out to the older ones who have all the teeth.
Okay. Yeah. So when should you first see your dentist? When should your child see a dentist?
Yeah.
Now, the rule of thumb is at the minute the teeth show, when they show up. So we're talking about 6 months plus or minus 3 months. So that's when you should see the
dentist.
See the dentist. People wait until the children have problems, or when they're shedding their teeth is when they're coming to the dentist. It should be, as you walk with your pediatrician, you walk with your dentist. That's number 1.
Yes.
Number 2, to remember, I tell people, if 6 months, if you want to remember, just say by the time they turn 1, the time at least they should have seen their dentist.
Yes.
So how do you start cleaning the children's, your baby's teeth? First of all, you can either use a toothbrush or you can use gauze. Okay, so you get gauze, you actually wrap it around your index. Cotton gauze, like the one you use in a bandage. Cotton gauze. Yes. You just wrap it around your finger, and then you hold the baby this way. Okay, so they're facing exactly in front of a mirror.
Yes.
And make it fun for the child, because initially children really at 6 months they don't want they will find it funny, and you want to make it fun.
Yeah.
So get a very soft toothbrush, those baby toothbrushes that are very soft.
Yes.
And just clean the teeth. And initially you actually don't have to use toothpaste. What we want to focus on is what we call mechanical removal of the plaque. Okay, that biofilm that has the bacteria. Those are the ones that what causes the cavities. You want to mechanically remove it.
Yes.
Then later you can probably introduce toothpaste slowly and make it fun for the child. And remember, I said you need to use age-appropriate toothpaste, because they'll obviously swallow.
Yeah.
Yeah. So if they swallow, it will be fine. You can either use fluoride-free or with little fluoride, so that even if they swallow so much, it will not eventually cause fluorosis. Because now, if you use adult toothpaste and they keep on swallowing that over a repeated time, that can actually cause them to have fluorosis. Okay? So you hold the child in front of the mirror. As you said, at 6 months, they only have 2 teeth. So you just clean those 2 teeth nicely, morning and evening. It is more important actually in the evening, because you have less saliva in the mouth. And therefore, bacteria take advantage. And that's when they actually now attack, and they feed on the carbohydrates. And when they feed on the carbohydrates, then you have the repeated acid attacks on the teeth, and that's when you start getting cavities.
Yes.
Now, before I forget this, some parents will say, my child takes a lot of antibiotics, and so the antibiotics are what have caused the teeth to decay. And the only known antibiotic, maybe there's another, that the one I know is tetracycline. That's the one we know that causes problems with your teeth. Otherwise, the rest, most of the antibiotics that we commonly prescribe in hospitals really don't have an effect on your teeth.
Yeah.
What happens is that most of these antibiotics have sugar. They have been laden with sugar. And because they taste bitter, so that the child can be able to
take it.
To take them.
Yeah.
So if you, and we've, since we gave the antibiotics and the painkillers at night before the child goes to bed, and then we don't brush, so what happens is that now the bacteria will actually feed on the sugar.
Okay.
And when the bacteria feeds on the sugar, now you start getting cavities. So it is the habits after that. Now, let's assume this child has all the teeth.
Yes.
And how do we actually brush? So we need to invest, first of all, in a soft toothbrush. Okay? When I say soft, it's like really soft.
Yeah.
Because most of us do a good job when we brush our teeth, but the places that we forget and the places that cause a lot of problems is near the neck of the teeth. So you need to get yourself a soft toothbrush, put a pea-sized amount of toothpaste on the toothbrush. Nowadays we say, because some people will say some peas are bigger than others, nowadays we say we just smear toothpaste.
Yes.
Just little. There you'd butter your bread, just little, little on the toothbrush. Then you angulate the toothbrush like this, and make sure the bristles spread all the way down to the gum line where I am,
Yes.
where I'm showing, as I'm showing, and then do either back and forth or circular motions to clean the teeth. Okay? Make it fun for the children. Put their favorite song. Most songs are about 3 minutes or long, so by the time the 3 minutes are over, that's when we should have been finished brushing our teeth. Come, then do the top surface of the teeth like this. Do the same thing on the inside, okay?
Yeah.
Angulate the toothbrush on a 45-degree angle like this. Do back and forth strokes. If it is the front teeth here, you do like this. Angulate the toothbrush. Make sure the bristles go all the way down to the gum line. Then you brush back and forth. Okay? If it is here, you clean this way. Okay? Out like this. If it is, as you said here, angulate the toothbrush 45 degrees. Make sure the bristles go all the way down to the gum line. Do back and forth motions like this, or circular. That. Same thing for up, like this, like that. Here we do out like this.
Yes.
And then we encourage our children to brush the tongue also. Okay? Brush the tongue also. And also floss. Because when you clean your teeth, you only clean 70% of the surfaces of the teeth. There is a 15% in between the teeth that is left uncleaned. And that is where most cavities start.
Okay.
So there are flossers for children that you can buy from pharmacies, and you encourage the child to just clean in between the teeth. Yes.
Okay.
So in a nutshell, that's how you do it.
Okay, thank you. Allow me to remind you, you can still engage with us on our SMS line 22232. That is 22232, and on 0708 222 323. Those are the lines you can be able to text in your question. And of course, Dr. Wambugu will be glad to answer you before we wrap up the programs. So I know that Terry talked about the diets the children can take. We also talked about, in case your child has had an accident, what you need to do, ensure that child has been checked by a dentist, you know. So let's talk about stains in children's teeth. What usually happens if a child has a stain in their teeth?
Okay. Before the thought escapes my mind, let's go. When we talked about your child hits themselves and they lose a tooth.
Yeah.
Now, when I was answering that question, I was referring mostly to milk teeth. Now, what about a permanent tooth? Maybe the child is 8, 9 years of age. They were playing, they were cycling, they hit themselves against the wall, and a front tooth came out. And this is something that not only parents should know, even teachers, because this can happen in school.
Yes.
So, if the tooth comes out, all of it, okay, we usually advise that you quickly get a glass of cold milk, okay, put that tooth inside a glass of cold milk, and run to the dentist, okay, because that tooth can actually be saved. And the sweet spot, when we talk about how fast should you get to your dentist and have it put back, is actually 30 minutes. Wow. Well, I have seen it replaced even after 2 hours, 3 hours, and have seen good results. But we say, and this is, I think, something that teachers should be taught in school. Take that tooth, put it in cold milk, and run, and make sure that child is seen by the dentist as soon as possible. Now, Staining. Staining can be caused by many things. It can be cavities that could be there that are stained, the cavities all over the mouth and then they look like they're stains. It could be fluorosis, as we've talked about. But we have what we call extrinsic stains, stains that are on the surface of the tooth.
Yes.
And we have what we call intrinsic stains. Now, extrinsic stains are stains that are caused because of probably hygiene. There are people who form stains very fast because of probably the types of bacteria that they have that when they interact with carbohydrates, they form, we call them chromogenic bacteria. They form stains very fast. And what is the solution to that? Just improving oral hygiene. Have your child, if the child has stains, those extrinsic stains on the teeth, improve the child's oral hygiene. We've said it's important to actually brush more in the evening.
Yes.
Okay, most of us brush in the morning because we're going to see people or to visit friends and things. So we're going to see the teacher, but at least twice a day. But evening is a must.
Yes.
Okay, so you improve oral hygiene. The stains should not recur after they've been cleaned by your dentist. So those are the extrinsic stains. Okay. Now, intrinsic means that they are inside the substance of the tooth. So we talked about fluorosis and how fluoride affects the enamel of the teeth. Fluorosis is treated depending on the severity. So probably that's a topic for another day, but depending on how severe the fluorosis is, that's how you know how to, what model of treatment that the child should get.
Yes.
But cavities are another common reason why people have stains. And there's something we call early childhood caries, where the child starts developing cavities all from 6 months all the way to 71 months. That's short of their 6th birthday. So we call that early childhood caries. And it's and before we had what we used to call nursing bottle caries, where if maybe to pacify your child, to make them sleep, you would give them a bottle to suck, okay, and they would calm the child down. And many times the contents in that bottle would be something that is probably formula or water with sugar or juices. And remember we said those sugars, what we call fermentable carbohydrates, are the ones that the bacteria feed on.
Yes.
And when they feed on them, they form acid. Now the contact time with the teeth, all you need is 20 minutes and you already have effects of what you have. So we really want to discourage parents from giving children bottles with sugar or even breast milk, because it has carbohydrate in it, to sleep with it to pacify themselves to sleep. It's important to also have checkups with your dentist so that they can see whether they have problems.
Okay.
Cavities, if the child has a cavity, we try our best to maintain those teeth in the mouth as much as we can. Because remember I said these teeth hold space for the permanent teeth. You start losing teeth early, what happens when the child is 6, 7, all the way to 12? The permanent teeth will come into the mouth and they will find no space because they're supposed to replace. As the permanent tooth grows, it eats away the root of the milk tooth.
Okay.
So if you remove a milk tooth too early, that space collapses and the permanent teeth, as it grows, it finds no space. And then now you start having other problems. You have to start maybe thinking of whether the child should have orthodontic treatment, which is braces and things like that. So it's important that we maintain those teeth as much as that. So what we do is that we fill those teeth. Sometimes we put what we call stainless steel crowns to maintain the teeth there, so that we have the teeth stay there for as long as is possible.
Okay. Before we wrap the program, we have a minute to go.
Yes.
I'd love you to talk about thumb sucking. How does that affect the growth of a child's teeth?
Yes, that is a very good question, thumb sucking. Now, when you put the thumb in the mouth, okay, children put this, we call this non-nutritive sucking because they're not getting any nutrition from it.
Yeah.
When they put it in the mouth, they get probably some soothing, they soothe themselves, or it starts that way and then becomes a habit.
Yes.
Now, when that action of putting the thumb inside the mouth creates the muscles in the mouth become very active, and what they do is that, number one, this thumb will, when you put it here, let's assume this is the child, it influences how this jaw grows. Okay, especially the upper side where the thumb is. Okay. Number two, because the child is sucking, these muscles now become so active and press on the upper teeth mostly. And so the child ends up developing something called an open bite. Okay, where when they bite with their back teeth, another you can picture this, the upper and the lower teeth don't meet. The front teeth don't meet, but the upper teeth meet.
It's like it's adjusted.
So when they smile, you can see the tongue.
Okay.
And they will, now, because now that space is there,
Yes.
that will affect their speech. Like for example, saying letter S becomes a problem, or letters that need you to have a lip seal.
Yes.
They'll start thrusting their tongue outside. Okay. So we try our best to discourage it. There are many methods of discouraging thumb sucking. When the children have permanent teeth from age 6, there are some appliances that you can put that discourage the tongue from, such that when they put the thumb in the mouth, they don't get that vacuum, that seal that gives them the enjoyment.
Yes.
Okay.
Yes.
But earlier, there are certain nail polishes that you can buy that are food grade, but they when you place them on the fingernails, they have a very bad taste.
Yes.
I'm not saying you use any kind of, this one is specific,
yes,
that your dentist can maybe help you order and see how it can be done.
Yes.
If that doesn't work, there is thumb guards that are sold on from the internet, where you can actually have a thumb guard. It is a sleeve that is put on each thumb, because if you put it on one thumb, the child will now
go to the other,
relocate and start using the other thumb. So it's usually put on the thumbs, and it is strapped such that the child cannot remove them. And when they put it in their mouth, because it's a plastic sleeve that has serrations on it,
yes,
they don't get that enjoyment, and that usually helps. But you're hoping the child will not start now doing the fingers.
Using the fingers, yeah.
But most of the time it works.
In the village, I heard of pili-pili. You just apply pili-pili and you see.
I would not advise that, because pili-pili is curly. Pili-pili is curly. I have not seen it work personally.
Yes.
I think that is torture in its own way.
Yes.
But if by age 6, the habit has not disappeared, that is when now you go to the dentist. Obviously, you've been working with the dentist.
Yes.
They will probably now place an appliance. And most of the time, we go for an appliance that the child cannot remove, that will help discourage them from thumb sucking.
Okay. Thank you. All parents, I believe that has helped you. Pili-pili hayes make. You need to think of something else. So, Dr. as we wrap it up, what would be, tips you'd like to share with parents who are watching us on how to take care of their oral health for their children?
So to wrap it up, I would say children's teeth are very important, as I've said, for nutrition of the child, for speech, because some letters cannot be pronounced without your teeth. Okay, for self-esteem. Okay, not just for girls, even for boys.
Yeah.
Okay, because if you have teeth, the child has no teeth or teeth are severely decayed, you will impact their self-esteem. Okay, the other thing is your own health. Studies have shown that the health of the parent, the oral health of the parent, if your oral health, you don't take your teeth seriously, your child is 3 times more likely to actually have poor oral health. So it starts with you. If you take care of your teeth, you're more likely than not also take care of your child's teeth.
Yeah.
Visit your child dentist at least by the time the child turns 1. By the time they have, the ideal would be when the teeth appear. But if you're not able to, by the time their first birthday, you should have seen the dentist. Let's avoid snacking on foods that have high sugars. Okay, let's snack on things that are healthy, that will not be a detriment. They will not cause detrimental effects on the teeth of the child. That's the third. And probably we should also have talked just briefly about pacifiers. Children, I see a lot of parents, especially we urbanites, we like giving children pacifiers.
And teethers.
And teethers. Yes, and teethers. We talked about teethers when we were talking about teething. Pacifiers are when they're given to children to help them, soothe them. When they're having for example, if you want to sleep and the child is fussy, you just give them a pacifier. I would encourage you, if you want to use a pacifier for your child, please make sure you buy one from a trusted source that is made of food grade silicone, okay? That is not a cheap one that you just buy off the internet and you don't know, because you never know the chemicals that they've used. That's number one. Don't introduce it too early to the child.
How early is early?
Because it's something we call nipple confusion, where the child cannot differentiate between the nipple and the pacifier. And so if you introduce it too early, what happens is that the child now, when they give them the pacifier, they can't tell. I mean,
they'll confuse the two. I prefer the pacifier, of course.
Yes.
Okay.
Yes. Or when you place them on the breast, they will not breastfeed.
Yeah.
Because now they think it's the
pacifier.
It's a pacifier.
Okay.
The other thing is, don't try and wean them off. By the time they are developing their teeth and starting to talk, by the time they're 12 months of age, try and wean them off the pacifier completely. Because at that point, they're starting to talk. The speech will be affected if they still have their pacifier on. Secondly, the same thing we talked about, thumb sucking, pacifiers. If I have seen 3-year-olds with pacifiers, even 4-year-olds, and what happens is that now the pacifiers now start affecting even the alignment of the teeth.
Okay.
Okay. And when they're also known to cause middle ear infections when you use pacifiers for a long time, and especially if the child is not being able to keep it very clean. I mean, a 3-year-old, a 2-year-old will obviously drop it and put it back in the mouth. They will get infections from the pacifiers. So please wean them off pacifiers early. And when I say early, is by the time they start talking, they should be off the pacifier.
Okay.
Yes.
I hope all parents you've had pacifiers. Bye-bye. Thank you, Dr. Wambugu, for being with us. We appreciate you. Looking forward to hosting you again and again on Health Check. My name is Grace Mutiso. I hope you have learned a thing or two about your child's health. Ensure you brush them tonight before they go to bed, and early in the morning, 1 times 2 in a day. If you can, times 3, isn't it?
Yes.
If you can. Allow us to say goodbye for now. Join us again next week for another episode of Health Check. Have a blessed night and keep it right to your Top TV. Look and live.